Welcome back to another edition of the Heart to Heart podcast. And my guest today is Dr. Ahmad Malick. He is an orthopedic surgeon and he's also the host of the Doctor. You're laughing. Did I say your name wrong again?
Yes.
Malik. Sorry. Dr. Ahmad Malick is joining us on the show today. Dr. Ahmad Malick doesn't exist and we won't say that anymore. So, Dr. Ahmad, welcome to the show, brother.
Thank you so much. You know what? I like your intro. I need to practice that for my podcast. It's pretty cool the way you rolled it out.
Well, I appreciate that. I kind of just do the same thing every time. So now it's just kind of becoming second nature, unless I get the guest name wrong, like I just did with you, even though you told me 2 or 3 times before the podcast how to actually say it. But something that I guess I just struggle with a little bit sometimes is names and getting them right. But anyway, you're not here because of your name. You're here because I love everything that you're doing on Twitter. I love what you say on Twitter. Your pinned tweet, I actually even have printed off here right now because it's something that I want to chat with you about, because it's a lot of things that I discuss, a lot of things that I think people should know about. So before we get started though, can you just give everyone a little bit of a brief background about yourself?
Yeah, sure. So my name is Ahmad Malik. No, God, see, now you got me going. Ahmad so Ahmad Malik. So I'm a white supremacist, racist, misogynist, fascist,
Is that what you've been
climate
called?
change denier, Putin lover, conspiracy theorist, dirty anti-vaxxer. Yeah, that's me.
So these are all the labels that people have called you, but I don't think that you believe you're any of those things, particularly not
No.
the white supremacist comment.
Yeah, no, not really.
I don't think you
So,
quite fix that as a brown person.
hey, listen, I can identify as anything I want. Don't hurt my feelings now, okay?
Listen, you said it. Now I won't do it for the rest of the podcast. Promise.
Men can have babies, so if I want to be white, why not?
You know what? That was something that I think I posted about as well. Like, if you now Google, can men become pregnant or can men have periods? Like, the first thing that will pop up is yes, which is,
It's
really,
crazy.
really crazy. Like, I can't believe we've gotten into this far of a stage with this kind of thing. But here we are, 2023, and this is
I had a
different.
scary thought. I thought this is like so stupid and ridiculous. Maybe the powers that are engineering this know this, and what they want is the backlash. So the pendulum, they're playing us. They're gonna get us all whipped up and angry because the masses aren't falling for this nonsense. And then the pendulum will swing, and then we get really ultra conservative. Like Handmaid's Tale or whatever.
Yeah,
Maybe. I was thinking that,
I do see your point to some degree. Like for example, say someone like Andrew Tate, why is he popular? He's
Yeah.
popular just because he's the complete opposite of wokeness. But if we didn't have, this sort of woke society that we live in right now, I don't think Andrew Tate would be half as popular as he is. And I think that Jordan Peterson's talking about this for, and other people, that like once you go one way, if you're going to the extreme left side, then sometimes people who are in the middle will then gravitate towards the right because they just want to be the exact opposite of what is the left. And for me, like, I don't try to stay in the center because, I think that's the best thing to do and trying to appease both sides. But, I just try to stay in the center because I do feel like overall I am, a centrist. Some people, will call me a
So
right
did you say
winger,
you're a Marxist?
a centrist, not a
Marxist. Yeah.
Marxist.
Yeah.
It's different.
All you Canadians are Marxists. Yeah. Yeah.
So
I get
I,
that.
so I feel like, I'm sort of right in the middle overall. I was never, like completely against the vaccine by any means. I think it did help out with the pandemic early on, but now in 2022, we can chat about that. We can chat about that for sure. But now, since 2022, or probably mid to late 2022, everyone's been infected with COVID. So everyone now has natural immunity. And I think that's the, driver as to why things are, fairly calm now and why we don't have any restrictions.
Can I just say something?
Absolutely, you can.
Let's not talk COVID.
Let's not talk COVID. Hey, brother, like I said, I got your sheet here printed out.
Because I'm so over COVID discussion. Like, I just don't want it to happen again.
I understand. And I'm sort of trying not to tweet or post anything about, COVID right now because, like I said at the beginning of the show, even in Canada, where we had really severe restrictions, we haven't had any restrictions at all now for about a full year. We don't even have to wear masks in the airport if we don't need to. So, and the hospital lifted their mandate as well. Like I think certain hospitals might still implement it, but it's certainly not something that you have to wear in a hospital setting now.
That mandates. Ah.
Okay.
Anyway,
so if we don't want to talk about COVID, let's just not talk about it. Let's talk about your pinned tweet, your simple guide to sod health. I love it. There's everything in here, so we'll go through it in detail. But before we do, what kind of prompted you to write this?
So basically, I never was a fan of Twitter. Okay. I used to find it quite a toxic place. Those cesspit.
Used to.
Yeah,
people you don't find it now, hey?
Yeah. I'm going to tell you why. So I was like, just thinking, man, all these people out here just ranting and raving and shouting at each other and throwing mud. And I was part of this right wing supranationalist party called the Brexit Party. That's a joke, by the way. We wanted to get out of the EU, and so I was on Twitter trying to promote let's leave the EU, this supranational organization. It's anti-democratic. I believe in the sovereign nation. I believe in decentralization, not centralization. So it's hard enough controlling our government in Westminster, and it's going to be even harder controlling something in Brussels. It's just not going to happen. So I joined the Brexit Party. I got involved with, tweeting away, and I wasn't a great fan of it. It was like, whatever. And I had a little following. It was very quiet, 1,000 followers. I'd tweet once in a blue moon or retweet. And during the COVID years, I tweeted against the mandates, and then I just stopped. I didn't like it. I'm more of an Instagram person. I like pictures and nice stuff, like fix a bunion, and this is how you should look after yourself, and all that kind of stuff. I'm not like into feet in a sexual way, by the way. Like, so
are you sure?
Yeah, 100%.
I thought you had an OnlyFans account where you actually just put your feet up.
You found that?
Yes.
You're my one subscriber?
I am. I'm the one who's been, paying you every single month. It's me.
Oh, dude, I'm sorry I've disappointed you with the lack of content. I work in that. So basically, I like Instagram. It's just nice. And I have a really nice little following on Instagram, and they're really loyal ex-patients and physios and all that kind of stuff. But around December last year, 15th, I think, I did a video saying, like, we need to look into these vaccines. No, they're not vaccines, jabs, experimental jabs. Because there seems to be a lot of side effects and some strange stuff happening. We need to investigate, patient safety. Something new's happened. Weird stuff is happening. I didn't know that people dying suddenly was a normal thing. I didn't know gardening was a cause of death. Breathing, standing, walking, talking was a cause of death. Changing your duvet sheets. Apparently these are all causes of sudden death. Which I think is a bit weird. We should investigate this. Anyway, that video suddenly went viral, and my, Twitter account blew up to like 4,000, 5,000. And suddenly the hospital medical directors at a national level were like on my case, telling me, stop tweeting. And, if you don't, you're going to get into big trouble. And, you're probably not going to end up working in our hospitals, which is pretty bad since I don't work in the state sector. I'm just full-time private. So that means no income. So I thought, bloody hell, that's pretty harsh. Where the hell did this come from? I didn't even say anything particularly controversial. I'm just speaking up for medical ethics and patient safety. So I thought, right, if they're telling me to stop tweeting, yeah, I'm going to do the exact opposite. So I ramped it up. No one's going to push me around and bully me around. I'm teaching my kids how to stand up to bullies. You know, what kind of example am I setting? So I soon realized there were a lot of people who resonated with the way I thought, which was nice because, the government made me feel as if I was all alone. I don't know how old you are, but there's like movie, this body snatcher movie, like in the end, I think it's Donald Sutherland. He's like the only guy standing around. Like everyone's an alien. You think everyone's an alien. You're the only human being left on the planet. At one point, I felt like I felt the whole world had gone mad. But now I suddenly found thousands of people on Twitter saying really nice messages and sending me nice comments. And suddenly I was like, oh my God, I've got a family out here. I've got a tribe. I'm not alone. There's a lot of people that think like me.
Mhm.
And I felt I need to like promote health and wellness because everywhere I look, it's the exact opposite. So I've been on my own health journey. So I wasn't fit and healthy for most of my life. I'm 48 in July. I think I really only turned things around in 2017, 18.
Okay.
I was overweight. I was diabetic, hypertensive, had a fatty liver. I felt like I was in my 60s, tired constantly. And if you think about it, it's a bit bizarre because I've been to med school and I tell other people how to stay fit and healthy, apparently. But here I was talking the talk, but not walking the walk. And it's funny, I've had a guilty relationship with food all my life and not the best diet, but unbeknown to me because I just followed the guidance.
How big were you at your biggest?
I was like touching 87 kilograms. I'm 5'7", so that's quite a lot.
Okay, so we got to do the math on that because we don't really work in kilograms here. But I think that's roughly 180 pounds or something like that. We can calculate it after. Um,
And now I'm 70. 70.
okay. That's a
So,
pretty
but
big drop.
I've still got a round big face, but yeah, it's okay.
It looks good on camera.
Thanks.
Yeah.
And so basically my dad was dying of cancer and he was the one that told me, one day when I came home late from work at 10 o'clock, he's like, what are you doing? You're about to eat now? Well, you should be going to bed. I went, why are you up? He went, well, because I've got a good reason. I've got cancer in my spine and I'm in agony and I can't go to bed. I went, okay, that's a good point. And he was like, look, you look like shit. You're fat, you're ugly, you look knackered. Your wife's sleeping, your kids sleeping. You left before they woke up. You came home after they went to sleep. This is ridiculous. And you do this 6 days a week. Like, what's the point of this? What's the point of living? Trust me, I'm a dying man. This is not the way to live. I was like, oh my God. So that was my wake up call. And then along with my wife, who, after our third child had put on quite a lot of weight as well, we were like, we need to sort ourselves out. How are we going to fix things? So all the things I've described in that pinned tweet are the things that I learned. And they're really simple. They're pretty actually bloody obvious.
They are.
But in the midst of propaganda and the fog of war that we're in, we've kind of forgotten what it means to be healthy. We're bombarded with bullshit,
We
you
are
know,
bombarded with bullshit, and I've
bullshit.
shouted this a few times on the podcast, and like, I have sympathy for people who are overweight, but I also think that we have to talk about obesity. Like, we can't be afraid to talk about a subject that is affecting people, and people talk about people taking up hospital beds and things like that, and unfortunately a lot of the time is from people who just don't take care of themselves. And if you look at heart disease, which is the number one killer by far in Canada and the United States, and I'm sure in the UK as well, it's about 80% preventable. So meaning 4 to 5 people could at least prevent their heart disease. Dr. Peter Attia thinks it basically could be 5 out of 5, like 100% preventable. And those are the messages that I think that we need to get out there. And like when people talk about longevity, and like I'm all for like, learning more about trans resveratrol and NMN and all these different things. But at the same time, if you want to, start with anti-aging, I think the very first thing you want to do is you look at the risk factors for the big diseases that kill you. Start with reducing your risk factors for getting heart disease. Start with reducing risk factors for getting cancer. Like look at cancer screening, getting your screenings done early. Those types of things I think are kind of like the fundamentals for anti-aging medicine. Whereas some of the other things like NMN and transresveratrol and NR and these other
So
things are
I'm
more
going to
like
interrupt there.
adjuncts.
I'm going to interrupt there. The cancer screening thing, I'd even go further back. No, you don't need lots of screening
But you don't think doing like a
tests.
PSA is a good test, like, to screen for prostate cancer? Like I find that, the reason why I think it's a good test and why I do it on some of my patients a little bit early, like even starting say at like 35, for example, is that, if you get prostate cancer when you're older, for the most part, you die from something else. You actually don't die from prostate cancer just because it's slow growing. But if you get prostate cancer in your 30s or your 40s, it's generally pretty aggressive. So, for me, I think it makes more sense to start the screening, fairly early, because that way, you can catch it early. And as we know, if you catch it early, it's much, much easier to treat. You have a much higher, 5-year survival rate as opposed to if you catch it late.
Yeah, but what I'm trying to say from a cancer point of view, generic all of cancer, you know, the main driving force is metabolic syndrome,
I agree.
and
Yeah.
hyperinsulinemia. There's too much
Yeah.
insulin and there's
Yeah. And
insulin resistance.
I agree. And one thing I'll say about that, and I'm sure you do this with your patients too, but like if I see a young person and their hemoglobin A1C say is 5.5, and for people who are wondering what a hemoglobin A1C is, it's your measurement of your blood sugar over 3 months. It's a fantastic test. Um, if I see that at say, 5.5, 5.6, most doctors will probably say to their patients, okay, like, listen, you're not diabetic because diabetic is 6.5 and over. You're not even pre-diabetic, which is 6.0. So, you're good to go. But, I think that you should try to optimize that, like a hemoglobin A1C of 5.0 is way better than a hemoglobin C of 5.6. So, I think that's one thing that we could do a little bit of a better job with, as
But
physicians as a whole.
we
Go ahead.
we also need to change the way we look at blood sugars. So the focus is too much on blood sugar level. What no one ever tests for, when was the last time you checked the insulin level, whether that was raised or elevated?
Fasting insulin is something that I do all the time as well.
Okay, because
Yeah.
the reality is what happens is your body's going to pump out lots of insulin to try and keep that sugar level under control. And it might be borderline normal or even normal, but it requires a massive amount of insulin to do that. And then suddenly, at some point, that effect isn't going to work anymore. And then you're going to have the blood glucose level that's elevated because you're insulin resistant. And what I find incredible is people who are type 2 diabetic, instead of dealing with the problem, they're now being told, all right, take some insulin injections. So this insulin level that's already high and has caused the feedback loop to be, to cause insulin resistance, you're ramming up the insulin level even more, trying to force, and the root cause of diabetes is very simple. Too much carbohydrate, too much sugar, not enough fats, not enough protein.
And not
And
enough exercise.
yeah, but you could pretty much reverse most type 2 diabetes by simply going on a keto diet. Cut out the
Yeah.
carbs, protein, and fats. And if you think about what we've been told all our lives, butter's bad, full fat milk is bad, lard is bad, beef tallow is bad, vegetable oil is good, low fat is good. It's nonsense.
But
So,
with regards to saturated fats, though, like saturated fats do increase LDL, which, for if you're looking at LDL, a lot of people like again, Peter Attia, Lane Norton, Kevin Bass, Kyle Gillette, like all people that I highly respect, do want LDL to be lower. And I don't want to go too much off on a tangent here, but I did
Remember,
write,
I'm a
write
bunion surgeon.
I did write something actually about this today. So, if you look at, like, again, I just named four, in my opinion, like incredibly credible people who have publicly said they're either on statins, or in Dr. Peter Attia's case, he's taken a PCSK9 inhibitor, which is one of the newer drugs that are out. They're all, in support of that. And if you look at the Mendelian randomization trials, it shows that lower LDL is better, is associated with a reduced risk of all-cause mortality. But this is where I get sticky. This is where I have a different, not necessarily a different point overall, but something that I find they need to address, that I can't really see how haven't really seen a really good discussion on it yet. So, okay, say we accept that low LDL is good. And for people who are, I probably should have at the beginning, LDL is considered to be, and this is sort of a stupid term, but your bad cholesterol, even though it's not even cholesterol, it's a transporter. But we'll just kind of leave it at that for now. So if you're in the camp of, let's get your LDL low, okay, I understand that. You look at the Mendelian randomization trials. Again, Mendelian randomization means that we're looking at people who have certain predisposed genetic factors and risks, that where they have lower receptors for LDL, and therefore they have low LDL genetically. So the studies done there are very good. But my problem is that when you look at the large randomizations of when you introduce statins or ezytrol, so two of the most commonly prescribed drugs for lowering cholesterol, they always lower LDL, but they never show any benefit in all-cause mortality or in even reducing risk of cardiovascular disease or stroke. So that's where my dilemma is with that. It's like, okay, I get all these guys, top-notch guys, really believe LDL is, the killer or the main driving factor for heart disease. I understand, the Mendelian randomization trials are indicating the same thing. But if you look at the intervention, like Kevin Bass, as mentioned, he's taken a statin. Kyle Gillette told me he's taken a statin. When you look at, the actual intervention, it doesn't actually do anything. Right. So like that's my
can I
whole
interrupt
dilemma
there?
there. Yes, I'd love
The
you to
thing
for
is,
you too.
look, I think the less drugs you're on, the better. I think
I agree.
the healthiest version of yourself is one that's not on drugs. And frankly, one thing the last few years have shown me is a lot of the studies that we're looking at, the data is fundamentally corrupt. The source data from the studies isn't even available to the peer review doctors. A lot of them have got conflicts of interest. A lot of drugs are being pushed on us and sold to us as the solution, but they're all fundamentally flawed. And I don't believe in this whole statin, good cholesterol, bad cholesterol nonsense. Cholesterol is vital for your human body, for your cells, for so many physiological purposes. And reducing the cholesterol with the statins has major side effects and complications. And I don't want to go into it because that's not what I want to talk about. But anyway, moving on. That pinned tweet is basically my simple way of saying that you can be fit and healthy by the choices that you make, not by taking a drug or having an injection. And unfortunately, these choices are very simple but difficult because they're simple. It's there, out there. They're free. It doesn't cost you anything. You don't need to go anywhere to get it. It's difficult because a lot of people have very bad habits, and habits are difficult to change. But the thing is, they've got bad habits. We want to change them to good habits. It's just a change that's difficult. Once you've done that change, it's easy.
Yeah,
So,
I would say that it's very difficult to initiate momentum, but once you have momentum, it's much easier to keep going.
yeah. And it's also because you start seeing the benefits. You start seeing the gains. You start saying, oh, wow, this is actually making a difference. Wow, my clothes are looser. Hey, I've got more energy. Hey, I feel better. I get lots of compliments. People keep saying, you look younger. Oh, this is great. I'm going to keep going. So, yeah, you're right. once you've got the momentum and you start seeing the gains, it gets easier and easier, and you keep pushing yourself.
And so go ahead.
No, carry on.
So, again, coming back to your sheet here, you talk about a lot of different things. It's not just diet and exercise. You have love, spiritual health, supplements, stress, intermittent fasting, exercise,
Do you know
sleep.
what I
Diet.
missed out? Do you know what I missed out?
What did you miss out? Let me have a look.
I missed out smoking weed.
Ah, now that is something that we should talk about for
So
sure.
can I confess? I've
Yes.
never smoked in my life. I've never taken any drugs or drunk alcohol.
Wow.
I just
Uh,
like I just like lots of sex.
wow. Well, I guess you're built differently than most people. That's good though. That's
But you know
good.
what?
I mean,
I
if you
I would be open to things like mushrooms and microdosing. A lot of people keep coming up to me now, friends and people I know, saying, "Hey,
yeah.
you need to try this." And I'm okay, I'm open to this idea. But
You-
I was always a bit nervous about cannabis. I'll tell you why.
and
My
I have something to say about that after, but go ahead.
So basically, my ex-wife's brother was a teenager when I first met him. And over the process of about 2, 3 years, I saw this little geeky teenage gamer kid become more reclusive and socially not functioning, not studying, dropping out of college, not able to get a job, sleeping all day, staying up all night, and then finally being diagnosed with schizophrenia. And he was a heavy smoker of
Like,
weed.
how much are we talking?
I have no idea. Dude, look at me. I'm
Okay.
fucking squeaky clean. I just know he would just smoke coming out of his bedroom all the time and it stank. And so this guy was just smoking all the time. And he was like full blown schizo to the point where at sometimes my ex-wife at the time would be like, I think you need to go. I think, he's mumbling about murdering you. I'm like, what the like the look he gave me, it was not a good look sometimes. But he could, it was not good. And I saw this kid, this young, skinny kid, bit geeky, turn into this incredibly overweight and then finally doped up with antipsychotic medication. And it was just horrible.
Yeah,
And
that can definitely happen if you introduce cannabis to the wrong person at the wrong time.
so, yeah. So, what are your thoughts on that? Because there is a link, isn't there? I mean, like
A hundred percent.
You
A
hear
hundred
Joe
percent.
Rogan, and Joe Rogan's like, yeah, everybody smoke weed, it's all great. Oh, and there's edibles, take edibles, it's all gonna be wonderful. Is there a best time to take it? Like, is your brain too immature when you're a teenager? I don't know. I
Yeah,
don't think you're properly formed until you're 25.
a
What are your
hundred
thoughts on that?
percent. So, I have a lot to say about this, but I'll try to keep it fairly short.
Go for
So,
it.
so first of all, it's kind of good we're talking about this. Is good timing. So, just maybe a week ago, maybe a little bit less, I said on my Twitter that THC is really harmful for teenagers and for people who are predisposed to schizophrenia. And then,
So
Alex Brand,
THC.
THC.
What does
So
that stand for?
so tetrahydrocannabinol. So that's the active ingredient that makes you euphoric or makes you high.
Dude,
CBD doesn't
remember,
make you high.
I'm an orthopod. I don't know the name of drugs. I don't know this stuff.
That's right. That's right. You only know how to do about 3 procedures, and that's it, right?
And yeah, and I know paracetamol, ibuprofen, and penicillin. That's it.
Okay. So
Okay, go.
so with regards to THC, if you give it to people in their teens, it can disrupt the developmental brain and it can lead to problems later in life, mental health problems in particular. And if you give it to someone who's predisposed to schizophrenia and they're a teenager, I mean, that's almost a guarantee for a recipe for bad disaster. Now, the flip side to that, though, is that cannabis is a very complicated plant. So, THC is one cannabinoid, but CBD is a different. Now, there are other cannabinoids as well. There's THCV, there's CBG, there's CBC, there's a million of them.
Careful,
Not
careful. I might get a headache. So
not,
what's the
I
difference
mean,
between
not a million, maybe about 100 to 140, depending on the literature that
so what's
that
the
you look
difference
at.
between this CBC whatever and the THC?
So CBD, so cannabidiol. So cannabidiol does not make you high. Okay, so we can't say it's non-psychoactive because caffeine or coffee is psychoactive. It induces a change in your
But that sounds
physiology.
like a pretty crap molecule. What's the point of that then?
So it's an amazing molecule. It's one of
Oh,
the most amazing molecules we have because with CBD, I can get little kids' seizures under control. I can get someone who has severe anxiety under control. I can get someone who has insomnia under control, although sometimes THC is needed for that. It can help people with chronic pain, particularly with muscle spasms. Like a lot of MS patients with really bad muscle spasms find that it's absolutely incredible. So, and it's just good for, buffering stress in general. So, I think there's a lot of amazing uses for CBD. And, it's unfortunate that it's almost would be better if CBD wasn't even part of the plant to some degree, because then it wouldn't have as much of a stigma to it because people think, oh, well, it's still cannabis. It's
so
still
so
gonna
what does CBD stand for again?
cannabidiol,
Cannabidiol.
cannabidiol.
Dude, you
Yeah.
can pronounce that, but you can't pronounce my surname.
Well, it's a little bit tricky because I've been in the cannabis space for 10 years. We're only meeting you today, but I promise that I know right now that it's Malik.
Well done.
There
Well
you
done.
go. Fourth
So
time's the try.
CBD doesn't make you high,
CBD does not make you high.
but
No.
it's got lots of medicinal benefits.
Lots of medicinal
So
benefits.
if you're dying of cancer, you got chronic pain, it's a good thing to take.
Yes. Now, I won't say it's as effective as like opioids, for example, but a lot of people do find it to be more effective than like ibuprofen or even cyclobenzaprine. Again, this is just anecdotal stuff that I've learned with my patients. I don't have like any randomized controlled trial right now where I can go look up on PubMed and indicate that
So
what I just said is
what is
has been
evidence-based
indicated.
medicine? What is evidence-based medicine?
What is evidence-based medicine? So that's a good question, and it's one that's sort of tricky to answer. So evidence-based medicine is supposed to be when
Yeah.
you look at the very best studies that are peer-reviewed, not by people with conflicts of interest, but by people who are just looking at the actual content of the data and looking to make conclusions from it, and then from that data, then you can base your medical or clinical decisions on. That's what evidence-based medicine is.
That's
But
wrong. That's wrong.
but let me finish. But I will say that unfortunately, what happens a lot of times is that when people look at these studies obviously, not obviously, but sometimes are confounded. And so they believe that they're practicing evidence-based medicine when in fact the material that they're basing their decisions on is flawed, and that's when you get into trouble. But
Dude,
you don't
dude, I need
can't
to
do it.
tell you something. I need to tell
Okay,
you
go
something.
ahead.
You're mistaken. So
How am I mistaken?
A Canadian professor whose name I can't remember, but you can Google him. Canadian professor
Yes.
defined evidence-based medicine. He was the first one to define evidence-based medicine. And it's like that's, like the Venn diagram type thing. You got the three circles and the middle is evidence-based medicine. So one of them, yes, is peer-reviewed literature.
Mm-hmm.
But only 1/3 of evidence-based medicine is peer-reviewed literature. You just said it's, all peer-reviewed. The
Yeah,
other
I'm
third,
writing this down. Yeah,
the
go ahead.
other third is clinical expertise. The
Okay.
other third is patient expectations and values. You put the
Interesting.
three together, that's real evidence-based medicine as originally described by Professor Sackett, Sackett, Canadian from the,
Imagine. And you and
Canada.
you and you had all this, bad stuff to say about Canada before the show, and now you're kind of, letting us know that evidence-based medicine was actually coined by a Canadian.
Yeah, but you guys have been brainwashed. You don't even know what it is. Look at that. So what I was trying to say was when you were saying I've been treating my patients and there's no real evidence, evidence-based medicine, part of that is clinical expertise, which is what you've described,
Mhm.
working in conjunction with your patients and their experience and their expectations, you got 2/3 of it. So just because you haven't published any peer-reviewed literature, you still have 2/3 of evidence-based medicine there.
Okay,
So
so let's just
absolutely, the problem is people have now been conned into ignoring the role of your expertise, the clinician, the importance of what the patient is experiencing, and relying solely on literature, which we now know can be corrupted.
go over. I mean, I think most people understand what peer-reviewed means. I think most people understand what clinical expertise means. Clinical expertise just means, you've seen patients in clinic and you've seen what works and what doesn't work. So those two are fairly obvious. But the third one you mentioned, patient expectations and values.
Yeah.
So can you kind of give us a little bit of a deep dive into that?
Well, I think it's just listening to your patient
But
and not
how is
just
that not how does that not number two though?
because
Like,
because
what's the
that's
difference
that's
there?
doctors that's doctor centric. That's what you think is working.
That's what I think is working. Okay, I
Yeah.
understand that. And
You
so,
need to listen to your patients. So for example, there's a lot of people right now saying they're jab injured. Here in the UK, and it sounds like pretty much everywhere in the world, everyone is dismissing that as got nothing to do with the experimental jab they've just had. Even though they might have died or had a heart attack a week after their booster, when they go to their doctor and say, "Hey, I've got a Bell's palsy. I've just had a heart attack. I'm only 36." They are dismissed and it's got nothing to do with, the jab. They're not being listened to. Their values, their expectations, their experience, none of that is being considered. And the doctor is saying, "Well, in my experience, this is safe and effective." So what I'm trying to say is evidence-based medicine is more. It's the patient, it's the doctor, and it's the peer review literature of the scientific community. It's everything.
so an example then of the third part of evidence-based medicine, patient expectations and values. Like, can you just give us just one concrete example of that?
Now you're putting me on the hot spot. Let's have
I
a
am
look.
putting you on the hot spot because it's something that is kind of difficult to discern between those two, and I would like to know the difference.
Yeah, I think it's a good question. Patient values
And
in evidence-based medicine. Right. There's tons. Oh my God, I'm PubMeding now.
okay.
So it's basically the evidence-based medicine triad. And it's about of what patients say they value in healthcare, including uniqueness, autonomy, compassion, professionalism, responsiveness, partnership, and being empowered.
Okay. But
That's
you just
what it's
kind
all
of
about.
grilled me about not knowing what evidence-based medicine is, and you can't even tell me what the third part is
No,
with a
but I just
concrete
did.
example.
I just did. I said listening to your patient. I said
So
listening to their
basically,
values, listen to their expectations. Everything I've just said, but I've just made it in more medical jargon.
okay. It is a little bit tricky to discern between those two, but I guess what I'm going to, or what I can maybe summarize it as, is that the second part is more of what the doctor believes or what he has, the knowledge that he's acquired from seeing the patients themselves. And then the third part with the patient expectations and values is basically just an accumulation of data of what the patient has said to you. I mean, to me,
You're still thinking of it as like data and papers, and that's the thing. It's not. It's giving the patient the knowledge and empowering them to make the right decisions. It's about giving them autonomy, not telling them what to do. It's not, you're still thinking of, oh, it's how, what's this patient values like? How do we collect this data? It's not. It's about empowering the patient, informing and educating them, and giving them autonomy and respecting them and showing compassion.
I
And
understand
the
that.
doctor part is very simple. The doctor part is you treat 100 people and you see how they respond to
Mhm.
your treatment. How many people did well? How many people didn't? How many complications did you have? For example, when you give CBD, is there a risk? Is there a complication? Do you tell your patients, "Hey, by the way, you might have a risk or a complication"?
CBD
And they might.
is, for the most part, is very, very benign. If you go beyond, say, 300 milligrams a day, you may have a slight increased risk of liver enzyme function. But other than that, and I mean, when I say benign, like, the side effects would be, I mean, well, CBD can make you a little bit tired. Again, that's why it's effective for people going to sleep. And then there's some debate in the literature about whether or not it gives you diarrhea, but that could just be from the carrier oil itself. So if you're someone who uses a lot of CBD and the carrier oil is full of, say, like MCT oil, which is known to, give people diarrhea, then perhaps, it's not necessarily from CBD itself, but from the carrier oil. But luckily, for the most part, CBD, and sometimes people can get a headache. So there are a couple
So you
side
just
effects
meant
from it.
this is the thing. There's no such thing as completely safe and effective. You know, I might do an operation and 1,000 times it goes really well. Well, 999 times, but there'll be one where I could have a complication.
Yeah.
And the reality is, it's very rare for a patient of mine to die from a blood clot. But in the last 20 years, two have. Now I've treated 15, 20,000 patients surgically, but those are two deaths. So nothing is completely safe and effective. So when it comes to your CBD, yeah, I mean, there must be some risks. And that's why I'm saying the second arm of the evidence-based medicine, you must be telling your patients, if, you have the CBD, there is a risk, and it might be one in, I don't know what it is, 200, 500 or something, that you might develop this. And this is from your accumulative knowledge over years of practicing, medicine and dealing with cannabis and
But
cannabinoids.
also, too, I will say that everything I just mentioned, all those side effects are completely reversible, meaning like once you stop taking the medicine, if you did get diarrhea from it, that goes away. If you did, if you were fatigued from it, that goes away. I can't really comment too much on the liver enzyme thing, but I would imagine, again, I'm just kind of speculating here, but I really would imagine that if you stop taking it, then your liver enzymes would decrease. Again, you got to use more than like at least 300 milligrams a day. And most patients use like, 50, maybe 100, sometimes a lot less. So, getting up to those numbers is not
So
very
why
common.
has there been an explosion in CBD everywhere? I see it like everywhere I go, I just see CBD. I mean, why is it suddenly just exploded onto the scene?
Well, when you talk about things nothing being completely safe and nothing being completely effective, I absolutely agree with you. But I will say that the efficacy to safety profile of CBD is, definitely one of the best out of anything, out of any supplement, out of any pharmaceutical I've ever seen. Like the side effect profile, like again, I said, is very, very low. And the ability that and what it can do for people, the effectiveness of it is extremely large. Like a lot of people come off their antidepressants with it. A lot of people come off of even like muscle relaxants, pain medications. Like so many people come off of so many medications with the use of CBD, and also too with the use of THC. But again, that is for specific patients and for specific patient populations. And again, as I said at the beginning of this podcast, and like I said on my Twitter, let's take away THC from anyone who is young in their teens and anyone who's predisposed to schizophrenia. But in that, don't throw CBD out the window, because CBD can be incredibly effective for teenagers, and it can be effective for people who have a schizophrenia. And that's actually pretty well documented. And I can tell you, especially based upon your, evidence-based pyramid that you just explained to me, is that I've seen so many patients come off of their antidepressants with CBD, and I think it's incredibly effective. So I think that's the reason why you're seeing it, is because it has a amazing ability to be incredibly effective, and while also having a very low predominance for side effects.
And it's not addictive.
And it's not addictive, right? And
How'd you take it?
that's the other hard part too, is that you can take CBD for a long time, and if you stop taking it, you will not get withdrawal effects, and which is pretty amazing. Now, when you stop taking it, you won't get the benefits of the medicine anymore. So if you may confuse that with withdrawal effects,
Mm.
but that's not withdrawing. Like it's like if you take, you know, Advil every day and it takes away your headache, and then all of a sudden, you know, you don't take Advil and you get a headache. Well, it's not necessarily get withdrawing effects, just that, you know, you're not taking Advil anymore, so it's not doing its job.
So CBD comes in an oil form.
Oil form, capsule form as well. You know, those are kind of like the main ones. You can get it in edibles. I try to steer people away from those just because they're generally filled with sugar and junk and that kind of thing.
Mm. So what about, so what's this thing Joe Rogan always goes on about? These edibles. That's not CBD. That's
E- Edibles, he's probably referring more. So CBD, you can get an edible form, but he's probably more referring to a THC. But I will say, you know, in Joe's defense, he has said several times that he also believes that, you know, THC can be very harmful, and even a couple of times. I mean, I don't really like admitting this, but I've heard him say on the podcast that he was actually a little bit more on Alex Brenson's side than my side when we had the pot debate. So I don't know if you know, but I was on Rogan about 4 years ago, I think now. And when I was on there, I was, you know, talking about cannabis. But I know we only have a few minutes left, and there was a couple other things that I want to ask
sorry.
you about your
I'm fascinated. I'm
about your
absolutely
simple guy.
fascinated.
No, it's an interesting, you know, topic, and you know, I think a lot of people, you know, do want to hear the risks and benefits as opposed to, you know, just the good or just the negative. So, you know, I think we had a pretty balanced conversation. So I think that was, I'm happy that you brought it up. But, you know, coming back to your things, like, you know, a lot of people talk about diet and exercise, like those are sort of like the two mainstays of, you know, being a healthy person. But I agree with a lot of what you have here. You know, you have love, you have spiritual health. Spiritual health is very, very interesting to me. Again, you know, the fellow Kyle Gillette, who I've mentioned a couple times, you know, he's very much into spiritual health. It's one of his sort of like six tenets or six pillars of health that he mentions. And, you know, I find in my life, even if I look at a lot of people that I know, like the ones who are, you know, who have really followed religion since they were young, and not necessarily just when they were young, but they're doing pretty well in life. You know, like it doesn't seem like they're too messed up. I mean, one obvious thing is that, you know, a lot of people who are spiritual, especially if you're Muslim, they don't drink, right? And drinking, as we know, can, you know, as Jordan Peterson says, it can wipe out almost about 10% of the population just right there. A lot of people have trouble with alcohol. But why did you put spiritual health on this, and why do you think it's so important?
That's a good question. And I didn't say religion, like just religion. I said
Yeah,
spiritual.
spiritual. Yeah, and I should use the word spiritual as well. Yeah, because you don't necessarily have to follow a religion to be spiritual.
Bingo. Absolutely. I think you're right about religion. I think religion gives a lot of structure and guidance. You could argue spiritual is very wishy-washy. What do you mean by that? Define that. Um, and religion, you know, it's pretty obvious. Religion is you follow a religion. Uh, I was a member of a religion. I'm not anymore. I like a lot of things about religion. You know, I'm very conflicted because I do admire all these major religions. They've got a lot of good stuff going on. You know,
They
they got a
do.
lot of good messages and parables and stories from history warning us about mistakes made in the past and what not to do again in the future. And, you know, good morals. But also, on the flip side, I find that a lot of religions ultimately are like cults. And, you know, our way is the highway, you know, the best way. And everyone else is damned. They don't do what we do. And our club is the best club. It's exclusive.
Mm.
And it's a lot of control, a lot of guilt, a lot of
Yeah,
shame.
I don't like that either. I don't like it when someone says that, you know, my way is the best way, and I'm going to try to convince you to come over to my way. And if you don't follow my way, like you're basically shit out of luck and you're going to have a terrible life. You know, I don't like
Yeah.
that at all. But the other part of that is that, you know, nihilism, I think, is very, very dangerous. And I think that nihilism is, is horrible, because when something happens, you have nothing to kind of like hold you sturdy, or something to like fall back on. And so when you have a spiritual practice, when the crisis happens, you can always, whoever your God
Yeah.
is, kind of like put your faith in God, or put your faith in, the universe, or the logos, or whatever you want to call it. Stephen Pressfield says, he prays to the muse before he writes every day. If you don't have anything to fall back on, I think that difficult times are going to be more difficult for you. And I think that spiritual health kind of buffers you against a lot of difficulty.
Absolutely. So for me, I I I have no evidence that God exists. I've never met him. Don't think I've ever chatted to him, like had a conversation like we are having now. Something deep inside me really wants to believe that he exists and hope he exists. I don't really believe in the whole heaven and hell kind of thing, but I'm hoping that there is a God. I also feel that
Do you
we're
believe in
part of.
karma though?
Don't know about that one. Not
No.
sure. No.
Like, do you feel that, like, okay, so what makes you do good in the world? Like, why would you do good in the world instead of doing
Yeah, so that's a good question. My mum was saying to me, "Oh, don't you think you should bring them up following a religion so they're good people?" I mean, well, look at my kids. Do they look like good people or not? I think innately human beings know right from wrong. They don't need to be told. Kids know what's right and what's wrong. Adults know what's right and what's wrong. And it's really simple. Do no harm, take no shit. It's as simple as that. You do those two basic things, everything's fine. And I don't need scripture in any shape or form to tell me how to be a good person. You fundamentally know. You listen to your heart, and I connect with the world around me, with nature, the world, the cosmos. I love looking at the sky. I love looking at the sunrise and the magnificence of that. It makes me realize my place in the world, in the universe, in time, how insignificant I am. I love looking at the stars. I do pray in my head to God, and I'm grateful and have gratitude, but I don't go to a temple or a mosque or a church. And I don't want to be told by someone to commune with God through that intermediary. I don't need a salesperson. I don't need someone to guilt me or shame me or control me.
and
And I'm kind of conflicted because I think religion is good in its purest essence and form. It gives you a feeling of being belonging to something and community. But then equally, I find that also divides people because people stick to the communities and don't break out and meet other people and realize that actually, when it comes down to it, all of humanity, all of the people are pretty much the same.
yeah, I
You
was I
know,
was gonna say, like, I read a lot of Stoic philosophy. I read it all the time. It's almost probably 50% of what I read. And you look at the quotes, say from Seneca or Marcus Aurelius, the big kind of Stoics, and they are very similar in a lot of ways to religious quotes. Like the like, I don't know the exact Bible quote, but like, this too shall pass, I think, is one. And like, that's something that comes up in Stoic philosophy like all the time. It's like, this is
do you,
something
do you
that's
have
just,
kids? Do you have kids?
I don't have kids. No.
I could tell.
How could you tell?
You just said you do a lot of reading. Like, it's like, what the hell? Like, is this guy for real? He does a lot of reading? What the fuck? Like, where do you get the time for that? There's no way he's got kids.
Yeah.
No way. The only reading I do is bedtime stories.
Yeah, I guess not having kids is one thing that I haven't done. I don't know if I'll ever do it. We'll see. But
Do you want to have
I
kids?
do use the time. I'm still sort of like indifferent to it right now. And but I think that missing out on being a father is a very, very hard thing um to deal with when you're older. Like, that would be a real tough regret. But then also too, I look at a lot of people I know who have kids, and you know it's not everyone, it's definitely not everyone, but a lot of people will say like, don't do it. Like, don't
Mate,
do it,
it's so funny you should say that out in
like so many
Canada.
people say that to me. They're like, just
Yeah.
like, don't do it. It's so hard. It's so expensive. You'll have
Do you
no
know
time
what?
for anything.
And you know
And
what? That makes me really sad. And I
it makes me
genuinely
sad
think,
too.
yeah, I think if you don't want kids, don't bloody have them because that's terrible in the kids. And I agree with you. Even here, there's people who, they have kids because they think this is it's a thing to do. It's almost like they're an accessory. I
Yeah.
pick up my kids early whenever I can. So if my clinic's not that full or whatever, I'm not, I've got a bit of free time. Instead of my kids going to the after school club, I pick them up early. And I was shocked when, the staff members, sometimes different teachers that come out, they go, "Oh, you want to pick them up early?" I'm like, "Yeah." Like, "Are you sure?" I'm like, "Yeah, they're my kids. I want to hang out with them." Oh, wow. Like, this is really strange. I was like, "Why?" Parents want us to keep the kids for as long as possible. You want to take them quicker, sooner? I was like, "Yeah, I want to hang out with them. I want to take them to the duck pond, the park, whatever, chill out with them." And she looks at me as if I'm a weirdo. And that makes me sad. And a lot of parents, I genuinely think, have kids because it's just a thing that they have to do. Well, I think, if that's the way it is, they shouldn't have kids. Better not to have
Well,
kids. If
let me ask you, I know we don't have too much time, but I want to ask you this question then about kids. So say if someone says like myself, I want to have kids because I want to pass on all the things that I've learned in my life and I want to, groom someone and I,
that's a
want
bad word,
to,
don't do that.
I
Don't
want
groom
to,
anyone.
okay, sorry, I shouldn't say groom, or I want to, teach them the things that I wish I was taught when, I was younger. And again, that's not a jab on my parents. My parents were awesome. They were super tough on me, but I'm happy they were super tough on me now that I look back. But do you think it's selfish if someone wants to have kids because they just think that they're going to be I don't want to say like a great parent, but they just want to have kids so they can,
Buddy,
teach the things that they
buddy,
really want
buddy,
to teach.
listen. I think it's the opposite. So remember we talked about love on my
Yeah,
pinned tweet?
yeah,
Listen, there's lots of different types of love. And
yes.
guys are mainly obsessed with sex and lust.
Okay,
And
so this is crazy that you're saying this. Okay, so two
why?
episodes ago, I had a
Yes.
guy, Thomas Seeger, on my podcast. He'd actually be a great guest for you, and he talked about the three different kinds of love. And you're
Oh,
right. The first one,
hear my version. Hear my version. And
no,
then you
no,
can tell
let
me.
me just finish. So the
Okay,
first
okay,
one,
okay.
if you just want to basically, get laid, so to speak, that's all testosterone. That's called lust. And and that's governed by testosterone. The second one, he calls romantic love, and that's interesting because it increases dopamine and norepinephrine. And so the reason why that's interesting is because Tom is a big cold plunge guy, and those are the exact same chemicals that are released, or neurotransmitters, sorry, that
I
are
do
released
cold plunge.
that
Yeah.
are released when you're in that kind of romantic love state. And then
Mm,
familial love, which is what you're talking about, that's when oxytocin is most present, and that's when
yes.
you feel this kind of like connection kind of love. The exception being though that like if it's like a mother cub that you piss off or attack her cubs, she's not coming after you due to excessive testosterone. She's coming after you due to oxytocin because she loves her cubs so much. She needs to destroy anything that's destroying them. Um, Man, I wish we could go on. I
No,
gotta
no,
have
let me
you back on the
hear my
show,
one. Hear
but
my
yeah,
one
I want
quickly.
you to
No, hear my one quickly. Hear my one
yeah,
quickly. So
go for it.
basically, the first love is one where you learn to love yourself.
Okay,
And
I
then
like that.
and you need to learn then how to give and receive love. And then you need to learn how to love unconditionally. And that's when you love your children. So you need to love yourself, and a lot of people don't for a very long time. You need to learn how to receive love from those around you, especially a romantic partner. You need to also give love properly to your romantic partner the way they want to be loved. Because people think the way you want to be loved is the same as what the other person wants to be, the way they want to be loved. And it's not. And it's definitely, you should look into love languages.
Oh, I
And
love love
then
language. I've
I
read that
love
book.
them.
Yeah.
Yeah. And then the next one I read it when I didn't have kids. And then
Okay.
the next one is, unconditional love, love for your children. It doesn't matter what they do. They can smash my computer. They can do whatever. I love them. It's unconditional. It's a beautiful thing to have. And what you're describing, what you want to do, you want to impart everything. You want to show them. You want to teach them. You want to give them. You want to provide for them. That's that selfless love that you're wanting to give. So it's a beautiful thing. It's nothing selfish about that, my friend.
Well, I really appreciate you saying that, and I
You
think
just
that's
need a girl, though.
I already have a fiance, so
A
we're all good
few.
there. We're
Oh,
all
you got
good
a
there.
fiance. I thought you said you've got a few.
No, no,
Fiance.
I just just have one. Just have one. Trust me, it's only one. Only one fiance. I'm not a
Well, then
woman with
you're
6, 7
halfway
different
there.
wives.
You're halfway there. Perfect.
Absolutely, I am. So Dr. Malik. See, I
Eh,
got it right again.
No, are
Uh,
you sure that was right?
I think so. I think so.
You sure?
Malik. Yes.
Yes.
Got it written down. That's what I said, Malik. Before we end, can you tell people where they can learn more about you, about your podcast, your Twitter handle, all that kind of stuff?
Yeah, I need to check. I need to look it up. It's www.docmalik.com. And that was just a joke. Malik.com. And my Twitter handle is Doc Ahmad Malik. And that's it. Simple as that on Instagram and Twitter. It was
Awesome.
nice. It was nice chatting to you.
No, it was nice chatting with you too. And like I said, I mean, the hour passed by very, very quickly. And I would love to have you, back on the show sometime to talk about some other stuff. So thank you so much again for coming on. I really do appreciate it. Thank you everyone listening. And as always, I'll be back again soon.